Thank you. A very good afternoon, ladies and gentlemen. My name is Sabhyata. I'm from Invest India. I'll be moderating today's session. I think we've already had a brief intro about who the panelists would be. I'll quickly introduce again. We're joined by Mr. Sunil Khurana, MD BPL Medical Technologies, Mr. Rishabh Telang, fitness expert and dream chaser, Cure.Fit, and Mr. Binil Mathew, manager, Startup India. We'll be talking about this very interesting topic on the opportunities and challenges for startups. And as we all know that startups thrive in a very, very unstructured environment. That brings me to my first question to Rishabh, which essentially is, what has your role been and experience in standardizing an otherwise very unstructured workforce in the healthcare industry?
Thank you very much for having me here, first of all. So I think the unstructured industry that you're talking about is fitness trainers. At Cult and all our partner gyms, we employ about 3,000 plus instructors, and which was otherwise a very unstructured working environment. So when Cult came in, we did a bunch of things. First, we just tried to create a code of respect and empathy around the working environment and in every interaction that we do with trainers, because that is something that was missing. I am a trainer myself, started Cult in 2015, and the first thing that I wanted to do at that time was make sure that people who live for passion, they start getting the kind of respect that they deserve. And because I come from a sporting and a training background, empathy is something that also took a core presence in our philosophy. Second, the biggest lever that I think played a part in terms of standardizing the unstructured bit in this industry was a highly efficient org, because I think it's all about people. I am a fan of technology. Of course, there is an app, and we do logging and all of those things. I log my own workouts and nutrition, but I feel that it is all about people. And I was, hearing the last panel talk about empathy in medical scheme of things, and in fact, I took a video of that because I was really impressed with the kind of things that were spoken about, and especially in the fitness ecosystem, that is something that was missing. So a highly efficient org powered by capabilities that can help manage trainers every single day with a lot of granularity. So we built all those systems over a period of time, and that helped us just standardize how we deliver workouts, which is otherwise very complicated, because it's essentially a set of skills that people have forgotten over a period of time, and teach them across a million instances every single day in a very standardized way. And that happened because of the capabilities and the people that I spoke about.
Interesting. I think that brings me to my next question to you, Binil. Given we just spoke about some of these challenges, what do you think is the role of Startup India here in navigating some of the challenges that startups in general face?
One of the key things that I think what would help is if I give like a small brief of the Startup India initiative. The Startup India initiative was set up by the government of India back in 2016 to help the startup ecosystem in the country grow, because at that point of time, while there were a bunch of startups who were working, creating good employment and also going ahead and contributing to the economy of the country, there was some structure that was necessary in terms of the support ecosystem that could be provided to them. And the challenges that are being talked about in terms of how employee welfare works, how empathy works, also requires an ecosystem to go ahead and enable it, where all the stakeholders involved in it also create it as a center of how they're looking at how the business is being created. With that in mind, the Startup India initiative, when it started, there were roughly around 4,000 startups in the country. Now that we are 7 years down the line, we have more than 99,000 startups who are registered within the country and who are being functioning within specific domains. One of the first things that helped in identifying what the like ecosystem required and the kind of support on structuring the ecosystem required was in terms of listening to the ecosystem through a specific program called the Startup India Yatra, which went to different districts of the country, talked to entrepreneurs, went ahead and told different partners within countries about what entrepreneurship can be. Now what ends up happening is when things start scaling, there's also different kind of support mechanisms that need to come into play. I was very happy to see Niramai on the panel like in the morning sessions, because Niramai was one of the first awardees of the National Startup Awards, which were started back in 2020 to go ahead and recognize startups who are doing great work in the healthcare sector, in multiple other sectors. So the government has been making schemes to go ahead and give support to the ecosystem at different stages. Initially, when it was in terms of awareness, there was a learning program that was launched, which is still functioning. Then when it was in terms of recognition, then there was a National Startup Awards program that was launched. Currently, there's a seed fund scheme that is operational to bridge the gap between the valley of death, where most startups come to ideation but aren't able to build their prototype, go to an MVP stage, where the government has now announced a fund which goes ahead and provides up to 20 lakhs in grant money and 50 lakhs in debentures to support these startups. Building on that, last year we also launched the credit guarantee scheme, which allows you to take credit guarantee from certain banks in the ecosystem. And now we are also working towards mentorship specifically through the Mark portal. So the way that the government has been working around this is building it block by block, because if you push out all the solutions in the ecosystem together, they will not be able to complement each other. And it also helps us learn how is it that the solutions can work with each other, how is it that they can help the startups to build economy in the country and job creation. The 99,000 startups that I told you about, they're now spread across every state in the country. They employ over 10 lakh people cumulatively, and they have gone ahead and help us become the third largest startup ecosystem in the world with the number of unicorns we have. So it's a step-by-step process that we are also working with the ecosystem on developing.
Great. I think with Startup India paving way for Make in India and giving a boost to our homegrown entrepreneurs, Sunil, my next question to you is, how do you think can the perception of Make in India be further developed in the healthcare industry in general and sort of reduce the dependency on foreign players?
Thank you, Sabhyata, and thanks for having me here. Sorry, my bad throat, so probably communication. First, let's understand what is the problem statement. Problem statement started a couple of years back when we all witnessed COVID pandemic. And that time we realized, as India in local, we are not ready with the sufficient medical devices. Patients were coming, getting admitted, and we were not having enough medical devices to support them. And that is a time when there was a lots and lots of young cry that we need to be self-reliant. We have to go into the Atmanirbhar side, and that is where this concept or this drive started, that let's make more and more medical devices within India. Today, burden is about 80-85% medical devices come from outside, only about 15% are made here. There are many challenges, we can actually have a lot of discussions there that how it has to happen. But medical devices itself is a very complex to understand. A glove or a suture or a syringe is also a medical devices. Other side, MRI, cyclotron or PET CT is also medical devices. You cannot have one regulation to manage the entire medical devices, entire end-to-end medical devices, whereas currently medical devices is being managed by Cosmetic and Drug Act. So there are long ways to go. Total globally medical device size is about 600 billion. In India we are sitting at about 12 billion. It's too small from government point of view to bring a lot of focus, but I'm happy. In the last 4 decades, I have not really seen this kind of drive, which is now happening in the last couple of years, that we want to make more and more here. I'm very, very excited to see the entrepreneurs, all these startups, the way those young boys are coming and actually taking up something very unique. They are going for a problem statement, they understand what is the actually issue they have faced or their families have faced, and they want to get into that. Many jump into without understanding the whole end-to-end understanding that what needs to be done and how the funding will come and how will they take the product to the market. That's a different aspect altogether. But there's a lot good happening there. My view is that next 15 years, this industry in India will cross $50 billion. That's my personal understanding. We have grown at BPL Medical 10 times in last 10 years time, 10 times. And I'm pretty sure that we will be a $1 billion company in time to come. So there is a huge scope. Praying propensity is increasing. People are now going for a proactive, treatment than reactive approach, which used to happen quite a lot earlier because you have a surplus money and awareness is there. So Make in India is bound to do well, and you will have a less burden on the foreign importation. Though we need to do many things at the government level. I am just looking at the time as well. So I'll stop here and maybe in the next round I'll touch something more. Thank you.
Great. I think in this context, Binil, my next question to you is, since we're already talking about schemes, government schemes here, how is the Startup India scheme specifically helping the startup ecosystem in the country?
Okay, I think I touched upon a few of the active schemes that we have, but what I'm going to do is give you a picture of how these schemes work in conjunction, right? Like currently the healthcare startup ecosystem in the country, we have over 9,000 startups who are currently functioning as part of the ecosystem in the country, which means roughly around 10% of all startups in the country work in the healthcare and lifestyle sector. Now, when we look at this, there is a gestation period that a startup is going through, and there are certain challenges through those gestation period that the startup is answering. A key question that they have to answer is, what is a product, how is a product helping the market, and is there a need for the market? A lot of challenges do come up on the initial stages of finding product market fit, especially in a sector like healthcare where trust is a key factor. Nobody wants to try out a healthcare product where there is a lack of trust. So how is it that you go ahead and build these trust, right? There are three ways that we as a scheme basically go ahead and help entrepreneurs with it. Because one of the key issues that was highlighted to us by entrepreneurs was in terms of that when healthcare startups are working with different institutions, there's a gestation period for even R&D development. In that R&D development, how is it that support can be specifically extended to them? A key part of this is the early period when product development is happening, where startups are given, of course, seed grant. But what they're also provided with is an opportunity to work very closely with incubators who work in the ecosystem. Because a key pillar of how startups develop is the incubator ecosystem. And for this specifically, Startup India has been working for the seed fund scheme specifically through the incubators. So the startups reach out to the incubators, apply through them. Secondly, a second problem statement that comes up is, okay, we have that seed money. How is it that we go ahead and build this as a business? Because that is an area where a lot of people do lack expertise. It's not necessary that everybody who's building a startup also knows how to build a business. Now, this is specifically where the MARC platform that the Startup India scheme has launched goes ahead and connects you from mentors from across the country who help you break down the idea of your startup, the business model, and the kind of support that you require. Now, why this is necessary is that the next stage, you have built your idea, you have tried out a small pilot, you've gotten some mentorship. The next stage is in terms of how is it that you create a scalable business, or you go ahead and also get funding from larger pool of investors, right? You need mentors who will guide you through that. You will also need schemes which help you along with this. And this is where we work very specifically with state governments in going ahead and encouraging state governments to have their own startup policies. The state startup ranking framework, which the Startup India team releases every year, goes ahead and looks at how is it that every state is specifically performing in the startup ecosystem. So in summation, what I would say is that there are three main factors that we are working at. We are working at upskilling the entrepreneurs themselves. Second, we are looking at how is it that the ecosystem in itself can develop, whether it be funders, because specifically for funders, we have an Investor Connect portal, whether it be for incubators, or even looking at our international partners. And third is in terms of going ahead and working with our state partners. And the schemes over a period of time, and there are multiple schemes that currently the government is working on. One of the key questions that comes to us is in terms of, is there any healthcare focused scheme? There isn't a healthcare focused scheme because the reason for that is that a lot of the problems that are faced by startups at the early stage or even when they're building are common across a certain paradigm in business. The specific support that they will require for R&D, the specific support they'll require for product market fit is then provided by the MARC platform, the Investor Connect platform, and other such initiatives by the government.
Thank you, Binil. Since we're already talking about schemes and some of the job opportunities that actually come in with that, Rishabh, my question to you essentially is, would you like to reflect on your journey as an early stage entrepreneur in the healthcare industry and detail some of the best practices as a homegrown Indian startup?
Yeah, I think, so when I started, it was fairly, I mean, fitness has not been a new concept. It's been there since forever. But when I started with a very differentiated concept. So the background is that I used to be an athlete, a basketball player, wanted to make my career in that sport, which did not happen. So I had to study, and then I knew I'll have to get a job. I worked in corporate for about 6.5 years, and then traveled a lot, different parts of the world, realized that my true calling is fitness and sports. So I got back to sports through Brazilian Jiu-Jitsu and competed again. While I was doing all of that, I realized that I'm spending a lot of time doing fitness and sports, not really doing justice to my job. And I really loved fitness as a concept and was thrilled by the idea of making other people fit. And that's where all of it started getting deeper into fitness as a science, research and methodologies and all the certifications that are happening. And through that I built a lot of connects and inspiration across different parts of the country, and those are the people who also helped me start the first cult center in 2015. And then over a period of time, a few things, of course, been very fortunate, met the right people, was there at the right time, worked very hard, was able to hire the right kind of talent. And fortunately in India, there is a lot of talent which is untapped. And we realized only when I started traveling to all the remote parts of the country. So suddenly from traveling to Europe and US and learning different forms of fitness, I started traveling to villages in Haryana, to Guwahati, deep south and all of those things, just to meet the sporting talent in the country. And that is where I realized there is so much love for fitness, there is so much passion for making people fit, that we can actually create an ecosystem out of this whole thing. But then they were all athletes, and being a good athlete does not necessarily mean that you can be a great coach or you can teach people fitness, and which is where capabilities like a training academy came into picture. So we built a standalone training academy for training all of those trainers who get onboarded on Cult. While there are these certifications that do exist, so if you look at American Council on Exercise, National Academy of Sports Medicine, and I do work with a bunch of them. I am certified with all of them. I do work with a bunch of them even right now. But then the courses that we created for our trainers were built for them, were built for, first of all, trainers in India. They were also built for trainers to deliver a great quality class in Cult. The downside is that all the research that mostly happens in the space of fitness has happened in America and things like that. So we did a lot of first-hand research in our setup. We also made sure that we understand what our members are happy about, what they're unhappy about, what are the things that can lead to injury. So, for example, any injury that happens inside a cult center is recorded, is deeply analyzed, and we take decisions on what movements should we retain and what movements should we relegate. For example, we realized that when we do lateral jumps, people end up getting injured. So we started removing lateral jumps and scaling it down. And this is just one example. I have many, many examples of changes that we've made through the data. And we made sure that all of those things feed into the courses that we are doing for our trainers. So a trainer, when they go onto a workout floor, they know exactly what members will be happy about or unhappy about. They are also powered by all the movement coaching and science that we teach them at the time of training. So some of those capabilities and how we manage them on a day-to-day basis through the org that I spoke about, a very highly capable team of people that are very efficient people managers, a trainer's app that helps them look at their performance every single day. Again, the continuation of training academy that trains them as soon as they fall into their performances below on any particular parameter. So a very foolproof system that helped us scale to so many instructors delivering the kind of quality they deliver. So all of it tying in from how I just had a lot of inspiration from trainers in different countries to how I understood and tied them across different sporting talent that I found in India.
Great. I think, Sunil, my next question to you is you brought in a very interesting point related to Atmanirbhar Bharat. So I think sort of dovetailing to that, given BPL is an approved applicant under the PLI scheme, which is the Production Linked Incentive Scheme, how is the PLI scheme helping in creating Atmanirbhar Bharat, and how do you think is it going to further create job opportunities?
Yeah, good question. Thank you. See, PLI is basically designed to promote the local production. So, Make in India and PLI are almost the same. What PLI brought is that they brought a lot of excitement. They created certain incentives where we all jumped into that to set up a new greenfield plant, and from there we make a product and company. Government is going to buy assured quantity from there because there will be a preferential treatment. At the same time, we will get certain percentage back, which can further come back into the system of R&D. So PLI has been amazingly good. But let's understand, what do you need to start the manufacturing? Before that, you have to have a product. Now, to have a product, you have to have a R&D. So either you have an in-house R&D, or you get a technology from outside. So there are two options. Either you get a TOT, which is transfer of technology from some company where products are already established, time-tested product, you get that, or you put your R&D people. So unless R&D is really scaled up, unless there is a very strong activity done at the R&D level, because companies may not have sufficient ROI, return on investment on the R&D, and they do a lot of shortcut. Now, what government has done a couple of weeks back, they have launched a new scheme by name PRIP, PRIP. This is Promotion of Research and Innovation in Pharma and MedTech. So this was actually much needed, and we were talking always about promoting and getting some kind of subsidy toward the R&D. And also government, what they're trying to now do is that if you look at the global organizations, they all have a tie-up with the academia. So I talk here, we have been listening since morning and several lectures about AI. You all know AI. But what AI I want to say here is very different. It's an academia and industry partnership. That is something very important, because if you go to IIT or ISB and these institutes, they're very bright people, professors don't have a pressure of ROI, and they can take some problem statement and solve it. Let us take, I'm giving an example that I want to, build one product by name AGM gas module. I might probably consume only 100 or 200 units a year, and probably 10 crore is investment there. It will never look me viable, and I'll keep buying it. But if institutes like IIT takes that as a project and gives to companies like us, technology is available, you start localizing it. So role of academia is a very, very big. So that is one area where we need to do a lot. Second, if you really want to make PLI successful, you also should see that then you get a preferential treatment, or you get some entry barrier of a similar products which are coming from outside. The barrier becomes little high, then only you can do it. Like you see auto industry. Auto has been given a lot of those privileges, and you cannot get imported cars from outside that easily. If you still want to bring, you pay very high entry barrier, high custom. Today, when we take a components, we pay high duty on the components which we use to build a medical equipment here, whereas the finished medical device comes at 5 or 7% custom. So there are still many things needs to be corrected. But I'm optimistic the way we are going, the way government is working. I must really give a huge compliment and thank to government body that almost every alternate week we get a call from ministries to know that what hurdles we are facing, what support we need from them. Though we still keep talking about single window which will solve everything. I'm still searching for that window. But overall, huge positive side from government to solve it. And I think PLI is going to go a long way. I have no doubt in my mind that today with the China +1, everybody wants to have an alternative to China, global industry. India is really very rightly poised there, and we can build a lot many products. Though R&D takes time to build a product, so we need to have both routes. Some we build inside and some we have a partnerships. I'm not trying to say against multinational. Let multinational also come and make product here, MNCs. But that will help us to further expand and have more and more jobs here. Thank you.
Wonderful. I'd like to thank everybody here on the panel with me today for all the lovely insights. We've typically covered the journey of a startup, the conducive environment which the government is enabling for the growth of startups and the healthcare industry in general to boost the innovation and investments. I hope the panel illuminated for you the opportunities available for India's growth story in the healthcare domain. We'd be happy to connect offline. Have a great rest of the day. Thank you.